A patient with hypertension has developed headache, tinnitus. This has to do with what? The inability to have perception, noise perception actually, noise perception. So you can't decipher noise perception. There's vomiting, high BP, on examination, facial asymmetry on the right. Volitional mobility is absent. Volitional means the ability to actually make a decision or to make a choice. Now this is absent. Another clue, increased tendon reflexes and muscle tone of extremities on the right. What motor disorder of the nervous system occurred in this case? Of course, everything is happening on the right side. So what is your answer? Of course, hemi. This is your most correct answer. Most correct answer. A 7-year-old child in the state of allergic shock, wow, caused by a bee sting, has been delivered into an emergency ward. High concentration of histamine was observed in blood. Of course, this is type 1 hypersensitivity. In type 1, this guy play a major role. Production of this amide was the result of the following reaction. Your answer is decarboxylation. Now, decarboxylation is simply the removal of carbonyl group from a compound and is replaced with a hydrogen. It actually converts amino acids to amides. Amino acid to amides. So this is your answer, decarboxylation. Decarboxylation. A 26-year-old woman consulted a doctor about having stool with flat moving organisms resembling noodles. Wow. These are helminths. Laboratory analysis revealed proglottids with the following characteristics: long, narrow, with a longitudinal channel of the uterus with 17 to 35 lateral branches on each side. Another clue for you. What kind of intestinal parasite was found? Now, your answer is between Tania solium and Tania saginata. Now, what is the difference between these two? Now, why I said this is your most probable diagnosis is because they have the same features. But of course, something differs, something makes them different. And that's what I want to highlight for you now. Okay. In Tania saginata, that's beef tapeworm, it is longer than the solium, the Tania solium, which is the pork tapeworm. Now, saginata again has about 15 to 35 uterus. Why I said this is your clue. It has about 15 to 35 uterus, whilst the solium has less than 13. So this alone should tell you that your answer is what? Saginata. Another name is this. Tania what. So I've given you the clue already. Am I right? Exactly. So this 15, 17, 35, of course, is more of what? Tania saginata. If it had been less than that, it would have been what? Tania solium. A man is 28 years old. Histological investigation of the cervical lymph node revealed a change of its pattern due to proliferation proliferation of epithelioid, lymphoid cells, and macrophages with horseshoe-shaped nuclei. This is your guy. This here is your guy. In the center of some cell clusters, there was a non-structural light pink areas with fragments of nuclei. What disease are these changes typical of? I've already told you that the key here is what? Macrophages with horseshoe nuclei. Macrophages with horseshoe nuclei. And these are found mainly in granulomatous conditions. Granulomatous condition. Now, a granuloma is simply an inflammation that is found in many diseases. It is a collection of actually immune cells known as histiocytes or macrophages. They form the main immune system attempts to ward off substances it perceives as foreign, but is unable to eliminate. Now, these ones are majorly found, I've already told you, but let me mention some of the diseases, then we'll come back to our answers. They are majorly found in tuberculosis, leprosy, rheumatoid fever, sarcoidosis, Crohn's disease, rheumatoid arthritis, cat scratch disease, streptococcus pneumonia, and so on and so forth. So, back to our option. Which one did you hear? Yes, tuberculosis. Tuberculosis. Yep. Sex chromatin was detected during examination of a man's buccal epithelium. It's a man, don't forget. And there's an X. That's what they mean. There's an X. This is a characteristic of the following chromosome disease. It can be triple X because triple X is strictly females. No. Down syndrome has got nothing to do with sex chromosome or chromatids. It's an autosomal disease. Now your answer is either Turner's or Klinefelter. Now, it can be Turner syndrome because Turner syndrome is actually found in females, which is actually 45. It is OX45. That's the karyotype. Now, Klinefelter is what? 47XXY. Man. Of course, Klinefelter. A patient having suffered a thermal burn developed painful boils filled with turbid liquid. I told you earlier on, turbid is usually described as serous. Don't forget. Now, what morphological type of inflammation has developed in the patient? No two ways in digesting this. It's just what? Serous. Autopsy of a man with tuberculosis revealed a 3 by 2 centimeter large cavity in the superior lobe of the right lungs or lung. The activity was interconnected with a bronchus. Its wall was dense and consisted of 3 layers. The internal layer was pyogenic, middle layer made of tuberculous granulation tissue, and the external one was made of connective tissue. What is the most likely diagnosis? My brother, this one don't think too much. Your answer is just, it's a type of tuberculosis, of course. But what type of tuberculosis are we talking about here? It's fibrous cavernous tuberculosis because it's affecting almost all the layers. All the layers of the myocardium. So, your answer is, did I say myocardium? Sorry. Of the lungs. So the answer is what? Fibrous cavernous tuberculosis. A 7-year-old child has acute onset of disease. Temperature rose to what? 38. Rhinitis, cough, lacrimation, and large spot of rash on the skin. Pharyngeal mucosa is edematous, hyperemic, with whitish spots in the buccal area. What kind of inflammation caused the changes in the buccal mucosa? Even this one, without you even knowing whatever the things are, what is it a suggestive of? Of course, it has to do with the respiratory what? Tract, the upper respiratory tract. And what is happening here? Catarrh. It's catarrh. So what is your answer? This is catarrhal inflammation. Catarrhal inflammation. Catarrhal inflammation. After a traffic accident, a 36-year-old patient has developed muscle paralysis of the extremities on the right. Take note, on the right. Lost pain and thermal sensitivity on the left. Wow. And partially lost tactile sensitivity on both sides. What part of the brain is the most likely to be damaged? They say posterior horn of the spinal cord. No. Right hand side of the spinal cord. Can it be so? Don't worry. Left hand side of the spinal cord. Motor cortex on the left. No. Now, why your answer should be the right hand side, or I think your answer should be on the right hand side of the spinal cord, is this. Now, when the right hand side of the spinal cord is damaged, don't forget, all sensation going from the right side will also be damaged. Yes or no? Exactly. Because usually this right hand side of the extremity is usually controlled by two types of fibers. We call them the conatus and then the gracilis. Am I right? So if the whole length is destroyed, or the right side of the spinal cord is destroyed, definitely proprioception will also be destroyed over there. Now, why we cannot choose this as our answer is because it is not the whole of the posterior horn which was being destroyed. Not the whole of posterior horn. It's just the right side of it. And now, let me explain to you why loss of pain and thermal sensitivity on the left was also impaired. This is because when they are actually controlled by a tract called the spinothalamic tract. This tract actually controls pain and temperature. And its movement, when it enters the spinal cord, it is contralateral. That means it will move. If you enter from the right, it will move to the left before it gives sensation. And if it's moving on the other side, let's say on the left side, it will move to the right. So do you now get it? Why there's disturbance in pain and temperature sensitivity on the left? Exactly. So it will not actually be affected on the right side, but it will actually be affected on the left side of the person. So your answer is right hand side of the spinal cord. A 4-year-old child has been admitted to an orthopedic department with a displaced shin fracture. Bone fragment reposition requires analgesia. Of course, you need painkillers because it's painful. What drug should be chosen? What drug should be chosen? What do you think? Of course, your answer should be promidol. Now, just briefly, let me just add to it that analgesic is used for the treatment of severe pain, actually, which occurs after surgery and stomach pain. Whilst promidol is actually used for severe pain in bones. Panadol used for treatment of mild and moderate pains. And morphine is actually antitussive and analgesic compound used for the relief of cough and pain in terminal diseases. Okay, while examining foot blood supply, a doctor checks the pulsation of a large artery running in a separate fibrous channel in front of articulocoralis between the tendons of the long extensor muscles of the hallux and the toes. What artery is it? What artery is it? Of course. Now, the artery that actually passes between this place is the anterior part of the foot artery, or the tibialis anterior. This one then give forth or give birth to the dorsalis pedis, where it will supply the dorsal part of our foot, not the sole, the dorsal part of our foot. So between it, this gives forth to this one. So your answer is dorsalis pedis, dorsalis pedis, dorsalis pedis. Yeah, exactly. Representatives of a certain human population can be characterized by elongated body, height variability, decreased volume of muscle mass, okay, increased length of limbs, decreased size and volume of rib cage, increased perspiration, decreased indices of base metabolism and fat synthesis. What type of adaptive evolution is it? Of course, this is tropical. 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 It's tropical. A 59-year-old woman has been hospitalized in a surgical ward due to exacerbation of chronic osteomyelitis of the left shin. Okay, blood test leukocyte is 15 times 10 to the power 9. Leukogram, myelocyte is 0%. Okay, metamyelocyte is 8%. Stap neutrophils 28. Stap, okay. Segmented neutrophils 32. Lymphocyte 29%. Monocyte 3%. Start blood count could be called. Now, definitely there's a shift. Which is what? There's a left shift. There is a left shift. But which one? Is it generative or regenerative? This is regenerative because you can actually see immatured blood cells in the peripheral blood. So it is what? Regenerative. Assuming they were absent, it would have been called degenerative. So this is regenerative left shift. A 41-year-old man has a history of recurrent attacks of heartbeats, okay, profuse sweating, headaches. Examination revealed hypertension, hyperglycemia, increased basal metabolic rate, and tachycardia. These clinical representations are typical of the following adrenal pathology. Adrenal pathology. So which one controls all these things? It's as one as hyperfunction of the medulla. The medullary part is actually responsible for such exacerbation. So your answer is what? Hyperfunction of the medulla. The medulla. The medulla. Take time and read the various parts of the medulla. Of the adrenal cortex. Of the adrenal gland. During autopsy of a man who died of acute transmural, that means the whole length is undergoing infarction. The following has been detected on the pericardium surface. There is fibrous, whitish, brown deposit connecting parental and visceral pericardial layers. What kind of inflammation occurred in the pericardium? Of course, look at another clue here. Fibrous white Sometimes this thing I don't think about it too much, because if I see something like this, no thinking. My answer is what? Croup-horse. A 12-year-old child developed nephritic syndrome, proteinuria, hematuria, and cylindria 2 weeks after a case of tonsillitis, okay, which is a sign of affected glomerular basement membrane in the kidneys. What mechanism is the most likely to cause the basement membrane damage? First of all, since they are bringing this in, you must know nephritic syndrome. What type of hypersensitivity is it? Is it type 1, type 2, type 3, or type 4? Actually, this is type 3. Type 3. Take note, it's type 3. And in type 3, we also call it what? Immune complex. Immune complex. Immune complex. So your answer is immune complex. Let me give you other diseases that are found in type 3. We have serum disease or serum sickness. We have Altos reaction, rheumatoid arthritis, lupus nephritis, systemic lupus erythematosus, intrinsic allergic alveolitis. So take note of all these things. A man arrived into a traumatological department with a trauma of the right shoulder. Examination revealed a displaced humeral shaft from the shaft fracture on the right in the middle 1/3 of the humerus. Okay, so know what artery passes there. A patient cannot extend the fingers of his right hand. Right hand. What nerve is damaged? What nerve is damaged? This is what? Of course, radial artery. Radial artery.